The U.S. administered 2.4 million doses yesterday, according to the Bloomberg vaccine tracker. It's a daily record. The pace of vaccinations here in the U.S. is continuing to increase, with an average of 1.7 million doses given each day over the last week. So far, the U.S. has administered 75.2 million doses. It's given at least one shot to 15% of the population and a full two-dose vaccine to 7.5%. So at the current rate, it will take an estimated 8 months to vaccinate 75% of the population with a two-dose vaccine. But that could change quickly as the FDA authorized Johnson & Johnson shot over the weekend. It's more convenient than the two other vaccines because it only requires that one injection and can be stored for months in a refrigerator. Joining me now with more is emergency physician at Johns Hopkins University, Dr. Gabe Kellen from Baltimore. Hey, Dr. Kellen, thanks for being here. Having a third approved vaccine in the U.S., it could protect millions more Americans from contracting the virus, but some people are worried about its efficacy. So do you think Americans should be hesitant about this one at all, given that the top line number seems less efficacious than the mRNA vaccines from Pfizer and Moderna?
Yeah, thank you. I'm actually very optimistic and enthusiastic about the J&J product. You can't really compare J&J to the previous two, Pfizer and Moderna. First of all, it was tested in a different era when there are so many more variants, and it was tested in 3 different large geographic areas: Latin America, South Africa, and the US. So if you're concentrating on the overall statistic of 67%, that's not the right number to concentrate on. Even the 72% generally for the US efficacy is not the number to concentrate. The number to think about is prevention of serious disease in 86% of the people in the US, where 10% of the infections are now the UK variant and growing. No serious disease in that many people, no deaths in anyone who got the vaccine from COVID, no hospitalizations. You're done with a single shot in 28 days as opposed to, say, 35 or 42. You don't have to worry about the symptoms of the second shot or being available. And this is one of the first times that we've seen evidence that it truly decreases the rate of being asymptomatic and having the virus. I mean, there's just so much to recommend this product right now.
Well, Dr. Kellen, the nation's top infectious disease doctor, Dr. Anthony Fauci, was all over the Sunday shows this weekend talking about it. Let's hear what he had to say.
People need to get vaccinated as quickly and as expeditiously as possible. And if I would go to a place where they had J&J, I would have no hesitancy whatsoever to take it. We've got to get away from that chain of thought, George, for the following reason. The only way you really know the difference between vaccines is by comparing them head to head.
Yeah, so making the same point that you made about comparing these head to head, tested in different environments at different times. What do we know about these vaccines and so-called COVID long haulers? Because it's not just the fact that people can get sick from COVID and die and be sick and hospitalized. It's also the fact that some people who have had COVID over the last year still have symptoms even if they've been recovered.
Yeah, we don't know what causes these long haul symptoms. And as you know, science is pretty intense on trying to find what might be the persistent inflammatory markers or some level of persistent infection, which is unlikely, but it's more that something is continuously being stimulated to make people feel pretty fatigued and just not recovered. And as you know, this isn't only for hospitalized patients, right? This occurs to people who were moderately ill, never needed hospitalization. Everybody should get vaccinated, even if they've previously been infected. And more recently, it's been thought that a single dose of any of these, once you've been infected, should do the trick. It's kind of like a booster.
So at the current rate, Dr. Kellen, it will take an estimated 8 months to vaccinate 75% of the population. How does the emergency use authorization of the single dose vaccine from Johnson & Johnson change that timeline?
Well, already, and I think you said this at the top, that We're hitting record numbers of vaccinations now. Pfizer and Moderna are ramping up production. So let's say we're at 1.7 million without this new product. That's like 50 million new people per month, and about 50 million have already had their first shot. I'm actually worried that in 2, maybe 3 months, by the end of May, we're going to be trying to convince people to take the vaccine, because all of those who want to have been vaccinated, maybe upwards to 2 million or 200 million or more, will have already been vaccinated. And then we're going to encounter the people who are somewhat hesitant, but maybe they'll be persuaded by all the rest of us who have been vaccinated and nothing weird had happened to us.
Yeah, yeah, that is a good point. I do want to talk about that a little bit. I do wonder how the difference in this vaccine, the difference of it one shot being versus 2 shots versus it not being an mRNA vaccine like the Pfizer and Moderna vaccines, will that help people who potentially have been hesitant to take the vaccines that have been available up till now?
My thinking on this is that the general population is just not going to have enough savvy to understand the difference between an mRNA vaccine and a vaccine that is piggybacked a piece of DNA onto another virus, and all those nuances. You could potentially tell people that the platform that J&J used is a true and tried platform. But the truth is the mRNA vaccine development isn't really overnight either. That's almost a decade in development as well. So I think we stick to the facts. It works, it's safe, and it gives you pretty good protection from dying or being in hospital. What's not to like?
Yeah, what more do people want? I mean, I'm eager to get any of these vaccines at this point, so I will be there when it is my turn. Dr. Kellen, I just want to end talking about where this vaccine can work the best, because it doesn't have to be refrigerated or frozen at ultra low temperatures. It can be stored in a normal refrigerator for months. Are there certain situations in the United States where this can work better?
Well, I don't know about better, but there's some situations that we think this would be ideal. Certainly, it's easier for office practices to be able to store this and give it to their patients. It would be ideal in emergency department settings where we do come across a lot of people who are transient or homeless or passing through town or not well acquainted with the healthcare system or don't like the follow-up, whatever that may be. We do a lot of vaccinating in mobile clinics. We go to senior citizen housing projects, and that's a very big production to take a whole team for a whole day per project for housing, senior housing. And so it would be ideal to be able to go into places where it's very difficult for people to come back for a second shot.
All right, we're going to have to leave it there. Emergency physicians at the Johns Hopkins University, Dr. Gabe Kellen, joining us from Baltimore. Dr. Kellen, thanks so much for your time.